Not mincing words. Joining me now is Dr. Susan Bailey, the president of the American Medical Association. Doctor, thank you for being here. I was really struck by your words that we just played there. I want to ask you that in just a second. But just first on this letter that was just put out, why did you all feel the need in this moment to speak up like this and call on the administration to take that step and coordinate with the Biden transition?
Well, thank you for having me. And there just isn't a moment to waste. We are in a critical portion of the pandemic where hospitalizations are beginning to skyrocket again. There are twice as many people in the hospital now as there were in September. We're afraid more deaths will follow. And we need to do everything we can to make sure that information is shared in a timely manner and that we are able to utilize all the tools in our toolbox to fight this pandemic. We know that unnecessary hospitalizations will result, chronic diseases will result, unnecessary deaths will result, and we'll end up with unnecessarily empty chairs at holiday tables if we don't work together soon and remind everybody that even though we're excited about new vaccine that are on the horizon, the tools that we have that work now are wearing masks, washing your hands, physically distancing, and avoiding indoor gatherings.
And Doctor, the Trump administration has said consistently since the election that information is publicly available in terms of vaccine distribution. That's for sure. They've also said that the Biden transition will be brought in and will be briefed when the time is appropriate, but that it's not yet that time. What kind of damage is actually going to be done if the Trump team doesn't work with the Biden team on this front?
As I said, we are already in a surge, and if we don't stop that quickly, we will see unnecessary deaths. It's important that all information be shared. Doctors, nurses, other healthcare workers are putting their lives on the line every day to try to save lives. And we need our leaders to work together, regardless of party affiliation, to make sure that we're doing everything we can to stop this virus now.
And to your comments from last week about how the fight that doctors are having to wage, a war on two fronts, as you put it, and you said, we will not go back. It was really striking. What is the impact of having to fight a war on these two fronts, not just against the actual virus, but against misinformation?
Doctors are dying out there caring for COVID-19 patients. So are nurses, so are other healthcare professionals. And the ones that are still working are exhausted. They're struggling. They're burned out. They're still having a hard time in some cases getting personal protective equipment. And to have to deal with that type of unbearable stress and pressure, and then realize that there are folks out there that are challenging your ethics to take care of your patients, that are questioning the science and the data that you're using to make your decisions. It's incredibly demoralizing. And this war on two fronts is simply intolerable. We all need to be working together to fight the coronavirus. We don't need to be fighting against ourselves.
It can't go not unsaid that, one of the persons pushing this misinformation is the president himself. The impact of that.
Well, we've been fighting disinformation and misinformation from many different aspects during the pandemic. We think it's important to listen to our public health officials, to listen to the science and to the data, and we'll all work together. We're really all on the same side when it comes to the coronavirus. We want to fight it, and we want this pandemic to end as soon as it can.
That's the most important reminder. We really are all on the same side on this one. Doctor, thank you for being here.
Thank you.